What is interstitial lung disease? Basically, it is a group of lung diseases that causes inflammation or scarring, that is fibrosis of the lung interstitium. Lung interstitium is basically the tissue surrounding the air sacs. You can see here in the images normal lung and the so where does ILD occurs? You can see here in the images there is a normal looking alveoli and the interstitial lung diseased alveoli. In ILD there are thickened walls of the alveoli, inflammation, fibrosis, there is a reduced oxygen diffusion and less oxygen in the blood. However, normally there are thin alveolar walls, elastic tissue is normal, there is easy gas exchange and more oxygen in the blood. So basically, the interstitium, the supporting tissue becomes inflamed and scarred and makes the lung stiff and less efficient. So the common causes of ILD are autoimmune diseases, environmental exposure, drugs, idiopathic. So autoimmune diseases basically are the rheumatoid arthritis, systemic sclerosis, that is scleroderma, systemic lupus erythematosus. The environmental exposure are bird proteins, mold, silica dust, coal dust, and asbestos. The drugs include amiodarone, methotrexate, nitrofurantoin, and there are some other drugs. And idiopathic causes are idiopathic pulmonary fibrosis, which is the most common type. So many cases are due to the combination of genetic susceptibility and environmental factors. So the symptoms of ILD are divided into early symptoms and the late symptoms. Early symptoms includes the shortness of breath on exertion, dry cough and fatigue. And the late symptoms are severe breathlessness, cyanosis, there is central cyanosis and there is clubbing, the bulbous fingertips. Now what happens inside the lung? Basically the pathophysiology is there is injury that leads to inflammation, then there is healing failure, and finally there is a fibrosis or scar tissue. So this inflammation basically leads to the stiff lungs and breathlessness, which is the symptom. And repetitive injury, persistent inflammation will be making the lungs stiff and less able to expand. Now comes the findings of HRCT, which is the most sensitive tool for diagnosing and monitoring interstitial lung disease. There can be appearance of ground glass opacity, which is basically the hazy area you can see here indicating the active inflammation or partial filling of the air spaces. There is a reticulation, the net-like pattern representing the thickening of interlobular septi. The honeycombing appearance, which is the cluster of the small cystic air spaces, a sign of advanced fibrosis. You can see here in advanced interstitial lung disease the honeycomb appearance. And the traction bronchiectasis, airways appear dilated and pulled open due to fibrosis. Now, in pulmonary function test, your typical findings in ILD are basically the restrictive type, in which FVC, TLC and DLCO all are decreased. Basically, lungs become stiff and less compliant and leads to smaller lung volumes and reduced gas transfer. Now the common types of ILD are idiopathic pulmonary fibrosis, hypersensitivity pneumonitis, sarcoidosis, and the connective tissue disease. In idiopathic pulmonary fibrosis, which is the most common type, there is a progressive fibrosis, occurs in usually older adults, and it has poor prognosis. In hypersensitivity pneumonitis, basically it's caused by inhalation of antigens like birds, molds, etc., and it may be acute, subacute, or chronic. And in sarcoidosis, there is a granulomatous disease, may affect the lungs and other organs. There is a bilateral hilar lymphadenopathy, which is very common. In connective tissue diseases, this is basically associated with the rheumatoid arthritis, scleroderma, myositis, and there is a variable patterns and prognosis in this type. Now coming to the treatment, you have to remove the cause first, like you have to avoid the exposure, birds, mold, dust, you have to stop the offending drugs and treat the underlying disease if it is caused by some other diseases. The medications for inflammatory ILD are the corticosteroids, immunosuppressants, and fibrotic ILD antifibrotics like pirfenidone. And supportive care is oxygen therapy, pulmonary rehab, vaccination, and smoking cessation. And in advanced disease, lung transplant is the final treatment. Now, to summarize the whole topic, interstitial lung disease. Basically, you should know the symptoms are dry cough, progressive dyspnea. There are on examination there are bibasal crackles. On investigation, there is a restrictive pattern on pulmonary function test. There is reduced DLCO and fibrosis on HRCT. Early recognition, identifying the cause, and appropriate management can slow the progression and improve the quality of life. Thank you.